Once again, thank you so much for tuning in to Bobo 89.1 FM. I'm your host, Chuck Taylor, and welcome to another exciting episode of Healthcare Today with the HSA. And we just crossed October 22nd, which was a big day for International Stuttering Awareness Day. And I have someone here with me who will help us kind of get a broader view and understanding of this, because this is a very challenging aspect of life because it involves conversation and involves just the act of being heard and the communication, which is if you've ever been in a situation where you lost your voice, imagine somebody living like that can't communicate effectively. It is scary. And we're here with Miss Faith. Good morning to you. How you doing?
I'm great. Thank you so much for having me.
So tell my listeners who you are. You're no stranger to the program, but once again, go ahead, give a little bit of the credentials, and then we'll dive right into the scenario.
Sure. My name is Faith Gealey. I'm the Senior Speech and Language Therapist at HSA, and I'm also, my official title is Team Lead for Speech and Occupational Therapies, but I am part of a team of dynamic speech and language therapists who provide speech therapy, care, assessments, interventions from birth through end of life at HSA.
And this is what you just ended right there with is probably what I hope people will understand. This is a scenario that can activate as early as birth, trying to communicate, and also towards the end of life when speech impediments become very obtuse. Imagine you being able to speak all your life, and now as you've gotten older, not able to communicate effectively. It just boggles the mind. But these are real life scenarios that we're talking about.
Yes, absolutely.
So tell me it in some other words. Let me understand exactly what is stuttering, and then we can get into some of the therapy services that are available for this, and we can go from there.
Sure. So in, layman's terms, stuttering is a speech sound disorder that's characterized by interruptions of the flow of the way that people talk. We can get into the science of it if people are interested.
Well, I am. I'm people. So and we have to remember, folks. What we're talking about is kind of a very short synopsis of it because this is deep.
It is. And this is an area where some clinicians dedicate their whole life. I was fortunate enough at Florida State University to have Lisa Scott as my Fluency professor. And she was one of the leaders of stuttering research in her time. And so she'd written textbooks, done longitudinal studies for the Stuttering Foundation, written counseling books, and, really was one of the people that helped shape speech therapy instead of this fix it to this looking at the whole person and this holistic view towards supporting persons who stutter. And so, I'm very fortunate to have studied under her and be able to translate that type of approach into HSA, and thankfully everyone on the team, all follows that type of mindset where we're looking at everybody individually and holistically, right? But stuttering, also known as stammering, so it's the same thing, it's just a different vernacular, is basically a disfluency disorder. It's characterized by repetitions of sounds, words, or syllables. Sometimes we notice prolongations, sometimes there's blocks. Or sometimes people use interjections like which we all do. And I think it's important to note that we all stutter at some point. We all are disfluent at some point, and sometimes we're more disfluent than other times, like when we're tired or we're not feeling well or we have a foggy brain, maybe like we're taking some medication or something or coming out of anesthesia. Those are all periods in our life where we might be a little bit more disfluent than normal. But people who have disfluency disorders or people who stutter at a higher percentage than what is considered the norm. So we would expect a typical person would speak within less than 2.5% of everything they say would be stuttered or disfluent.
There would be some sort of repetition, some sort of pausing, some sort of
interjection. Yes. And that is normal, right? Think about when you're mad or you're upset. Sometimes, you're just, and I just can't, and it's but we can't find the words. Exactly. So that is a normal part of the way that we speak. People who stutter it just happens to them at a higher frequency. And with research, science is able to help us understand a little bit more. Like there's been 4 genes that have been identified as possible genes that affect stuttering, but that's only in 20% of the severe stuttering cases. There's also some research that supports that there's some, so I'm getting really technical here, but I think it's important for people to understand and learn how their body works. And so there's some research that discusses that this is potentially an issue in the basal ganglia. So if we're looking at the sort of the bottom, if you think about your brain, like sort of near the bottom of the brain, that's your internal timing, right? And so that's what helps you pace. So when you look at research, children who stutter are less likely to kind of follow the beats. And so there's just like an internal timing that's off. And so that affects the speech sound movements.
I remember when I was in school, we had a young gentleman who stuttered, and for him, singing and the cadence of rhyming, when he sang, he didn't stutter. And we always thought it was like, wow, when you sing and when you say these nursery rhymes and things of this nature, you don't stutter. But when you try to talk, so with him, we kind of got in the habit of him kind of almost singing what he wanted to say and kind of rapping to what he wanted to say because it came off clearer to him. Is this kind of what we were looking at?
Right. So that's a phenomenon that is common with most people who stutter. If they're whispering, if they're singing, a lot of times when there's some type of timing provided for them, they're able to produce more fluent speech. And so there are some natural phenomenons where you see that sometimes also when people are acting. And so there's a lot of famous actors like Emily Blount and James Earl Jones who are like famous stutterers. There's a lot of singers who are famous for their stuttering. And so not famous for stuttering, but they're famous and they're known to be stutterers. And so, but that's actually one of the strategies that we use to treat persons who stutter is using external timing cues, so like time syllables, to sort of help provide a basis for that rhythm of speech to assist with more fluent speech. And we can talk more about treatment of stuttering disorders later on.
Well, we just crossed October 22nd, which is what we observe as International Stuttering Day. Why do we observe this? And I mean, we understand, that it's globally, but why?
Well, part of it is just to help raise awareness about stuttering. It is one of the most common speech deficits that affects persons and it impacts their quality of life. There's no cure for stuttering, so people who stutter, it's something that they have to live with for their whole lives. And it can really impact their quality of life because a lot of times people are impatient with them, with how they communicate. It affects their confidence and their self-esteem and their confidence in expressing themselves in the work setting and social settings. So, it just helps to raise awareness. One, so that I think generally the world is going towards a place where we're really focusing more on inclusion and realizing that just like how we have diversity in terms of our physicality. So some of us might be short, some tall, some, on the heavier side, some on the thinner side, differences in eye color, skin color, hair texture. And those are all just wonderful examples of the diversity of humanity. And so we're starting to realize that we have just as much diversity on the inside. So we have just as much diversity in our neurology, in our communication styles, in the way that we think, the way that we learn. And that's okay if you're not part of that cookie cutter mold. And so it just helps to increase awareness and acceptance of people who stutter internationally.
Well, one of the things that I would like to say is that, there has always been a myth, and listen closely, folks, a myth of linking stuttering to intelligence.
Yes.
That's the first thing I want to, we can get into all the science, but let's take a look at this real quickly. there is nothing that goes so. Am I good in saying that?
You are good in saying that. Stuttering is not a cognitive disorder. Does not impact intelligence whatsoever. It simply impacts the muscles and the speed in which you're able to speak. So it's simply a motor speech disorder. It has nothing to do with your intelligence level.
Okay.
And so that is a myth. You're correct.
And folks, that's like me not running as fast as Usain Bolt. That's just how it is, but I can run. And I can run okay for me, but I'm just not as fast as him. So once again, it is something that, in the past, people I know and folks, we're trying to level the understanding of us. And people have been cruel in the past, and this is one of the things I hope doesn't continue.
Yeah.
People who stuttered have been bullied. They have had a hard way just because they were not understood. And when I say that, that's on us. It has nothing to do with them. That if someone speaks Spanish and I don't understand Spanish, does that make them less intelligent? No. So the fact of that, we have to understand and be able to grow with this person, because especially now, I think, when I'm nervous, I stutter. I'm speaking engagement and I'm like, calm down, because I will stutter.
Yes.
And this is just one of the things that, we have to take a look at, because as we said, it's not linked to being less intelligent in no way, shape, and form.
No, not at all.
Not at all.
And a lot of times people will say, well, like, where does stuttering come from? And it's one of those things that we don't have a definitive answer. A lot of times you'll hear some of the old wives' tales and, it's because you stood behind a horse and, like all kinds of things.
Right.
And if you put a nutmeg under your tongue, then, you won't stutter. And like, it has absolutely nothing to do with that. What we do know is that it does disproportionately affect boys than it does girls. We know that there tends to be a strong genetic link, which would make sense now that we found some genetic markers that help to identify stuttering. And there's, like I said, they've only found 4 definitive genes that seem to be associated with the stutter in some way, shape, or form, but there's likely more.
Okay.
Because that only accounts for a small percentage. But we do know, for example, that there is a not for example, because I was about to give an example, but we do know that there is a stronger genetic link, and a lot of times it's passed not necessarily directly. So, for example, when I was working in the States, there's my for example. So, see, even I as a speech therapist am not always fluent, right? And I didn't realize that these 2 kids I was working with were related until I was doing the intake. One was an established child that I had inherited onto my caseload, and one was a new child. And I called the mom and did an interview, and I said, "Oh, do you have family members who stutter?" "Yeah, he has a cousin who stutters, and his uncle stutters, and the other uncle stutters, and the grandfather stuttered." And so it was, and then I was like, "Oh," and she's like, "Yeah, the cousin goes to the school," and I'm like, "Oh, okay. So this is clearly a genetic associated stutter, right?" And so you don't treat it any differently, but a lot of times when we're doing our evaluations,
there's some markers.
Those are some of the questions that your therapist may ask you, like, is there anybody on either side of the family who stutters? It might be an uncle, a grandparent. And it's not to say it only happens in the male family members. It can happen in females too. It's just it tends to be more males that are affected. Yeah.
What are some of the early signs of stuttering? I mean, we once again, because it's motorized, it's something that you can adjust over time.
Yes. Yeah.
So what are some early signs that we could look for in a young child?
In a very young child, yes. So you'll notice that they may be repeating words or phrases a lot. There's 2 main types of stuttering. So we have developmental stuttering. So this happens as a child, and neurogenic stuttering, which is I've had a stroke, a brain injury, some type of neurological trauma that has now triggered me to stutter as an adult. With developmental stuttering, some children do outgrow it. There are some researchers that feel like it's a disconnect between how quickly the child's vocabulary and just lexicon is growing. and just a disconnect between what's in their little brains and what's coming out of their mouth. So typically what we're looking for is if this has been persistent for more than 3 to 6 months, you may notice some frustration from the child. Some children, it doesn't bother them, but you're noticing a consistent with certain words, blocks. They're trying to get the sound out, and it's almost like they're on pause. So, they might be like, "Mommy, what are you doing?" And so you might notice that. And a lot of times it frightens parents very, because they're like, "What's going on with my little one?"
They think something is neurological.
Right. Yeah, they get concerned, and they want to make sure their language is developing okay. It might be part word repetitions or part sound repetitions. It might be just the first part of the word, let me see. So it might just be like, say if they're talking Paw Patrol, they might say paw, 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 paw patrol. So you might notice that repetition of the words. For very young children, you notice an inflection change as well. So you'll notice that rise in inflection. So they'll go, Mommy, I was, because they're trying to push the sound out. And for some children, you may notice some tugging. You might notice that they're tugging at their lips, or things that we call secondary behaviors, which is not the actual speech, but it is physical things that they're doing, whether it's tugging at their lips or slapping their leg or snapping their fingers or like stomping their feet. So it's not uncommon to see persons who stutter have secondary behaviors. And so that is also a sign that this is something that's really bothering the child. Right. And so we encourage families to bring their child in to get an evaluation. We would do a thorough case history. We'd also look at your child's language and their speech sound development, just making sure that everything else looks normal. And what we would do is through play, try to get a good language sample so we can see examples. And I tell parents, don't stress about it. Sometimes they don't stutter in front of you initially, and sometimes they stutter even more than they do. And so I encourage parents also to grab videos of the child stuttering at home, just to kind of document it happening because you can't always make a stutter happen. Right. So it's nice. And then we just kind of evaluate it, look at the length of time it's happening, the family history, to see if this is something the child is likely to outgrow or if this is a true stutter. And then we just start working with the child and giving the parent and the family strategies on how to cope. A lot of times, just with good parent coaching, the child is able to resolve without much intervention when they're really young. Okay. But if they're a little bit older, they may need a little bit more one-on-one intervention.
On average, because everybody's different, and so we're going to talk kind of in a broader sense. How long does an intervention can take? Because as I said, each case and each person and child is individual, is individualized. But on average, when can we kind of see some movement in the right direction?
I tell families it really just depends on the child. We are huge fans of episodic care. The research is really going in that direction. And at HSA, we're always looking at what is evidence-based. For a long time, there was this view that, you needed intensive intervention, more is better, and just basically overload the child. And actually, research is showing that therapy burnout is a real thing for kids. And that really and truly the best thing to do is to combine parent coaching with episodes of care. So typically what we would do is do a 12-week episode of care. So a 3-month period where you would work with the clinician, and we're working with the child in our sessions quite intensively, doing lots of modeling, but we also have the family and the caregivers involved and are constantly doing parent training in conjunction with it. Depending on that 12-week mark, we may decide to extend the episode for a few weeks, maybe to a 16-week episode, depending on how the child is responding. But normally in our clinic, we have seen massive improvements with episodic care, and that's in line with where a lot of the pediatric hospitals, the big pediatric hospitals in the U.S. are going towards that. And the research is showing 3 strong episodes of care per annum is just as effective, if not more effective, than intensive therapy for 1 year. Wow. And so, more is not always better. And so, and I think that's a shift that we're not seeing in a lot of the other facilities, and that's definitely, I think, one area where HSA is standing out, because we're doing episodes of care and the families are just blown away when we are saying, yeah, we'll do 12 weeks and have a look, and then in 12 weeks they've made more progress than they have like in a year, and so they're so surprised. But it's in line with what the research is showing, and we're constantly challenging ourselves to do what is evidence-based. Yeah.
Sounds good. Once again, folks, thank you so much for tuning in. It's Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking with Miss Faith Gealey about International Stuttering Awareness Day that just happened on October 22nd. We'll be back in a few moments, and we'll continue our talk about stuttering and also speech and language therapy, and also the services that the HSA provides. Be back in 2 and 2 right here on Bobo 89.1 FM. The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Once again, thank you for tuning in. It's Healthcare Today with the HSA. I'm your host, Chuck Taylor, and today we're talking about International Stuttering Awareness Day, which just passed on the 22nd of this month. But this is something that is got to be one of the most challenging situations for anybody who has this I want to call it a change in lifestyle, because once you start stuttering, your whole world changes.
Yes.
And I have with me Miss Faith Gealey. Miss Faith, go ahead and tell them your credentials over there at HSA.
So my name is Faith Gealey. I am the Senior Speech and Language Therapist at HSA. I am the Team Lead for Speech and Occupational Therapies. I have a master's degree in Communication Sciences and Disorders, and I have been a speech therapist for 15 years. 14 at HSA.
and those credentials goes without saying. I got to just dive into it. So over the HSA, speech and language, tell me a little bit about the therapy that goes into that. I mean, I walk in with a child or myself, and I have some sort of appendage in communicating. I don't want to say disorder. I don't want to say... I'm just not communicating effectively enough for myself and for you. Tell me what I can do to help, or what you can do to help.
Sure. So we have a team of 3 therapists, and we're growing soon, which I'm so excited about. We offer a huge range of supportive services for communication and for feeding. We deal with articulation disorders, feeding and swallowing disorders. We offer Orofacial therapy, Orofacial myofunctional therapy. As far as I'm aware, I think we're the only clinic that has that specialty on island, I believe. We deal with developmental disorders, so a wide range of communication stuff, okay. Language disorders, voice issues, as well as neuro-cognitive issues for adults, and of course, as we're talking about today, fluency disorders. And we offer evaluations and treatment in all of the above from birth through end of life.
In fluency disorders, we're dealing with specifically stuttering.
So stuttering, basically fluency disorder is the umbrella term for stuttering. So Western Hemisphere tend to refer to it as stuttering. Even though the UK is considered Western. In the UK and in Europe, you might hear them say stammering more, but it's the same thing. As we came out, you say same dog puppy. Okay. Same thing. Same thing.
Just from a different region.
And fluency disorders is just sort of the umbrella term that talks about any issues with your fluency of speech. Okay.
And when you say fluency of speech, what are some of the different types dealing with that?
Sure. So typically we would categorize it as a developmental speech disorder, meaning the onset is during developmental years, so in childhood, or a neurogenic speech disorder, which this has happened in adulthood, but the result of that is more related to an acquired neurological condition. So you may have had a stroke, a head injury, you may have reacted poorly to anesthesia. So there's usually been some type of trigger or some type of damage caused to the brain that has now caused the stuttering to be expressed. And so with developmental stuttering, which is the most common type of stuttering that we deal with, normally parents start to see some red flags of it from about 2, definitely by 3 years old, because, between 2 and 3, you see that transition from that baby talk to like more mature communication. And so definitely between 2 and 3 is when parents start to notice that onset of stuttering. Sometimes it can happen later, and that's just the nature of it. But that is the most common type. Once we've diagnosed your child as having a stutter, then they're typically grouped into a fluent or non-fluent stuttering, meaning your stuttering is characterized primarily by blocks, so like things that are stopping the flow of air. So like the block is literally where you're like frozen in your speech, or it's fluent where it's very fast, but we're seeing a lot of those like part word repetitions, whole word repetitions, prolongations, those sort of things.
So there is a difference in, would you say, as we talked about earlier, the timing of it, whereas because you mentioned swallowing. Is that because I know when I talk on air, I get out of breath, and I'm fighting to get the words out before I finish my breath. Is this something that you see with people who stutter a bit, where the swallowing and the air breathing has kind of given them some restrictions? Is this something? So
not normally swallowing. Swallowing is not normally a part of fluency disorder. Now, you can be a person who stutters and also have dysphagia or a feeding disorder, but the two are not necessarily interconnected. Okay. You can sometimes, as a result of learned compensation strategies. So a lot of times people who stutter kind of come up with their own little tricks and strategies to compensate and deal with their stutter. And so sometimes you can see some just inappropriate breathing strategies, that sort of stuff, just not really being coordinated and knowing how to use my breath to strengthen my voice. So you may see some of that in stuttering, but it's not, the two are not mutually exclusive either. Yeah. Okay. Typically what we see is that there is a timing issue in the rate of speech. And so the speech is either too fast, too slow, or is impeded, the rate of speech is impeded by the stutters themselves, whether it's interjections. So I'm talking and I'm putting in a lot of interjections in my communication. I may have a prolongation where I'm holding the sound for a long time. I may have a part word repetition where I'm just doing a syllable or just a small part of the word, or I could have a whole word repetition, typically with a monosyllabic word where I'm repeating the word in its entirety, or I could just be having a block where there's a pause of air, almost like they're frozen or stuck in that sound,
and they can't get it out.
And they can't get it out, and then there's like an explosion when it comes out. And so there's a myriad of techniques that.
That's what I was just about to ask. You just mentioned probably about 5 or 6 different versions of the idea of stuttering, and each one of them comes with a different technique to address them. On a whole, I always thought that, and mind you, this is kind of debunking it, that stuttering kind of, you were thinking, but you couldn't get the words out, because that's what we have been kind of told. Oh, you're looking for the word. You need to know more words you're not communicating properly.
I can't tell you how many times I've had family say, I just shout at them, or I just tell them, get it out. and then they get it out. And I'm like, please don't do that. Please stop doing that. Yeah. But it's just, again, it's just myths that have been perpetuated. And again, like people just not being aware. And so they kind of come up with their own kind of tricks to the trade, so to speak, to compensate for it. And families come up with their own dynamic of how to deal with stuttering. And typically what we would do is we would look at one of the things that we do at HSA is we're very focused on patient-centered care. So from the initial conversation, as soon as the child shows that they're cognizant enough and aware enough about their own speech, we get them involved, and we do use social stories and different great children's books that talk about Joe Biden's wife. She wrote a great book about the President Biden's stutter.
Yeah, and people don't know that he has had a long history of stuttering, and I mean, it comes out now and again, but you don't notice it. But I remember I saw him doing a speech at in the U.S. The legislative. It was the House of Representatives back in the late 80s, early 90s. And I was like, this can't be the same man. I mean, and at first I thought, he was just angry. But then I realized he was actually stuttering.
Yeah. I mean, we have prominent members in our community who are well respected and are known famously throughout our community to be stutterers. But we also know them to be very intelligent, very competent, and despite it, still very articulate people. I mean, I think of one gentleman in particular, and I'm not going to name him on air because, I believe in respecting people's privacy. Right. But I mean, I can listen to him all day, and I forget that he stutters because of the content and what he talks about is so interesting to me. And I just think like the archive should lock him up and record him because he's like literally a walking encyclopedia of Cayman history and legislative history, and but such a respected person in this community, right? And so, but. When I would imagine when he was growing up, there really wasn't access to any of those things.
That's what I want to kind of get at. In 2022, with all the understanding and the movement forward, it has changed drastically from, say, 10, 12 years ago, even 20 years ago. So where are we with the science today?
So the science shows there's still no cure. There's still no known cure. And like I tell my families when I'm working with people, very young children, like there may be times where we need call it a top up, so to speak. We may have responded beautifully to therapy and nice fluent speech, but there are times in a child's life where due to puberty, hormones, illnesses, social triggers, like maybe now I'm interested in girls or now I'm interested in boys, and that adds a whole different dynamic of now I'm self-conscious about my speech and all of my strategies have gone out the window because I don't want anyone to notice and I don't want to stand out. And so so there'll always be like periods through your life where you may need a little bit of additional support, but it's just as needed. And I have some patients that do great, and then maybe like a year later we notice, our stuttering has kind of come back. So let's come back and do some more strategies, and see if maybe the strategies that worked for us a year or two ago may not necessarily work now because of how I've developed and how I've changed. And so we do a variety. I mean, there's fluency shaping techniques, there's easy onset, where you're using the flow of air to lightly stutter on things, so it just reduces the severity of your stutter. There's time syllable techniques, which I love for kids, where I literally just use a metronome and we just talk in a robotic voice. But what it does is helps to reset that internal timing, and it kind of breaks the pattern of the disfluency speech. And then we talk faster and faster until I have a more natural rhythm of speech, and add in inflections and add in all the stuff. And I've had great results with that technique. And so, but every child is unique. Every individual is unique. And so, like I tell my families, like I have a bunch of tools in my toolkit,
Your toolkit.
right? And so guess what? If the hammer don't work, we got the screwdriver. The screwdriver doesn't work, we got the drill, And so I tell families, like, envision your therapist as literally a toolbox of different strategies, different techniques. And so I'm going to be using different techniques, and every technique that we find that works, I'm training you on it. So you can facilitate it with your child. And just, the best technique is actually, though, just being a good model and modeling nice, smooth, easy speech. And so because we tend to emulate
what we hear.
Now, there are some myths about you can catch a stutter.
I was just going to come to that. Hold on. Let me just say this. Growing up, and this is something that I've heard before, if you're stuttering, you got to take a deep breath or think about what you're going to say before you talk, because you're going to stutter. Just take a deep breath and then you say what you're going to say. Nothing don't go so.
No. So the deep breath is great for patients who have voice issues, but not for stuttering, unless you happen to be a person where you carry a lot of tension as a secondary behavior. And then we may encourage some deep breathing techniques just to relax the musculature a little bit. But that's not a one-size-fits-all approach. And there would be very specific parameters in which we would describe some breathing techniques for. So no.
And see, this is one of the things, we I love my Caribbean people, and I say that with all honesty. This is something that we've heard over and over in our community. Growing up, we've had family members, and usually at a young age, it's you have so and so who stutters. When you're around him, you got to talk slower. You got to, and these types of things. And I always thought, where did they come up with this idea from? Is this known? Is this something that somebody is taught? No, it was kind of just, this is what we've always done, but it was not. It was not proper. It was not the science. In fact, I think, we probably heard a lot more than we helped. So that's one of the reasons why I wanted to make sure that we have, as you said, enough tools in the toolkit for you to make the right assessment. If you're seeing at an early age or in a later stage, go talk to Faith over there at the HSA. Talk to her team. Get assessed so that you can make the right decisions moving forward. Because communication is it right now.
It is. And, part of the reason that at HSA we push for, this is why we come to do programs like this for, the different various awareness days and weeks, and like for stuttering awareness, because I can't think of a single person who isn't aware of at least one person that they know, that they've met, that they admire, that, or they're friends with their child, with their kid or whatever, that stutters, right? We all can think of at least one person who stutters, because it is one of the most common speech sound disorders, or speech disorders, I should say. Sorry, not speech sound disorders. But 40% of treatment success can be attributed directly to the external factors involved in that patient's life. So that is family support from their peers, support from their teacher, like the people around them, helping them to feel like they are okay, that they are supported, that they are heard, and using those supportive strategies with them across their different natural environments. 40%.
So
60% is only me. 40%
is outside. External forces.
Yeah.
Wow.
Yeah. And that's a huge number.
That is a massive number.
Yeah.
So folks, think of it this way. You can help someone who stutters just by being there and talking and being supportive of them.
Yeah. Just listen to them, allow them to get their thought out, even if it takes them a long time. Don't finish their sentences for them. Don't interrupt them. Don't yell at them. Just allow them to talk the same way that, in a normal conversation, you would allow someone to get their own thoughts out and their own ideas out. That's the approach that you take with someone who stutters. And your response to them, if you're noticing that they're really dysregulated and that they're really stuttering more than usual, be a model and just speak to them in slightly slower, smoother. If you notice, I'm kind of almost talking in that smooth way.
Talking to you is very calm.
Right.
It's you don't notice it, but underlying now, it's very calm. It's very smooth. It's almost like a song being played.
Yes, very melodic and just short syllables and just nice and smooth, slightly drawn out speech, but it's just modeling. And so when I'm dealing with my young kids and we're talking about smooth speech or bumpy speech, we give lots of visuals, roller coaster speech and all kinds of different types of speech. And, we encourage our kids to visualize and what do you feel like your speech is like? What do you feel your voice is like? Is it like a river? Is it like a tree? It's strong? Is it weak? Is it flowy?
That's awesome.
And so we really make it about the patient and patient-centered, and counseling is a huge part of our role as a speech therapist, because we have to shape families' behaviors if they've been engaging in things that could cause the child harm or cause that person harm, or like in terms of their self-esteem and self-worth. And just empowering the patients to say, listen, fluent or not, your voice matters. What you have to say matters.
It's important.
You're seen, you're heard, you are important. Regardless if you never speak a fluent word again in your life, you are entitled to your voice. And so a lot of that we do is empowering the child and letting them know that your voice, your fluency of speech is just a unique characteristic about you. And there may be times when it's not as smooth, and there may be times when it is super smooth. And either way, it's okay.
And I think that in itself, self-esteem is important, especially for the younger generation.
Absolutely.
I mean, we'll get into the older part of the realm of it, but speaking from a younger generation, being heard and being seen, no matter what it is important. So imagine now that you have some sort of impediment on top of that. That's a lot of weight to try to communicate with your peers. Even in this day and age, as adults who stammer, it's still hard to communicate with your peers.
Yes.
So imagine a 6, a 7, a 10-year-old. That's a lot of pressure.
It is. And so we encourage our kids to, in building up their self-esteem, especially when they're really young, you'll find like they're so resilient. And so they don't let it bother them. And then we teach them how to advocate for themselves and to say to their peers, we practice things like, I don't care what you say about my voice. My voice is my voice, and I love it, And so we teach them to, the same way you would empower a child about, their hair texture or any other kind of unique attribute about them. We try to empower our kids to say, listen, your voice is your voice, and you are empowered to say what you want to say. And so we utilize both technical things, so in terms of ways to shape the stutter, but then we also provide a lot of adaptive supports in terms of making sure like cognitively they understand their stutter so that they can go to their friends and say, hey, this is why I stutter. This is why my voice sounds like that. Because what we find with kids is that actually educating kids. So when a kid says, well, why does a child sound like that? Or why does a child look like that? Or why is that child different from me?
Right.
And a lot of times parents be like, don't point, don't say that, that's not nice. Explain it.
They have a question.
They have a question. Explain it to them. Make it a class project. This is let's learn about it. Absolutely. And so through that education, that helps to create a more inclusive environment, a more supportive environment for the child. And so then when their peers are on board, you'll find their peers will be like, oh, hey, you use smooth speech, thumbs up, and you'll find like the peers become, yes.
The reward is there.
It becomes this like great intrinsic motivation for the child because they are being supported by their peers. And so then they'll be like, oh, Miss Faith, I, had to read out my book report today and I only started 2 times because, I used my strategies and it was so hard, but I did it, and that sense of accomplishment that the kids experience.
Let me just toss this out. How does that make you feel?
Oh, it makes me so happy. I just love all my patients as they're my kids. And I can say that because I'm a mom, so I know what it feels like to love a kid. And oh man, there's some that just, they just grab at my heartstrings.
One of the things I when I talk to people, and this is a little bit off the subject. When I talk to people, I think part of the joy of what they do is the success of what they do. In other words, the joy that you get from working with this is the success of them seeing it in you.
One of my patients actually, he just graduated. So he's on a break right now, but he is about to go into high school. And very severe stutter, one of the most severe kids that I've worked with. And we did a 12-week episode of care, right? At the beginning, 9% of the time he stuttered, which is a huge percent. When we were done, he was down to 3%. And if you remember at the beginning of our conversation, I was saying anything over 2.5% is considered a stutter. So he went from 9% to 3% of the time stuttering. Was like great, happy, proud of himself. And actually at the end of it, he was like, I want to be a speech therapist. And I was just like, yes, and we need more guys to be in speech therapy anyway. And I was like, I tell you what, if you still want to be a speech therapist and I'm still at HSA, I will make sure you get every internship, every support. I will be there for you, and I check in with them still, so, that's one thing that we tell our families, like, once you've come to HSA, even if you're not actively on our caseload, you can call us anytime. If you pop in, see if we have a free minute to talk to you, send us an email. Once you're one of ours, you're always ours.
You're always ours.
And so, we're here to celebrate all of the challenges, celebrate all the victories, support through all the challenges. Even if you're not actively on our caseload, we make ourselves available. And it just makes you feel so good to say that, okay, there's like another generation coming down the road. Mm-hmm. But, they're inspired because of their own, he was just like, it was so hard for me. And now, like, I feel like I can handle the pressure of high school. I'm not worried about people, making fun of me anymore. And I just use my strategies and I know what I need to do. And, when I'm home and I'm with my cousins, I don't focus on it as much because I know they don't care. But like at school, I'm a little bit more concerned about it. But mm-hmm. He's like, I can handle high school now. I feel great about going to he wasn't feeling as overwhelmed and nervous about mm-hmm. going to high school. And I just think it's just so wonderful that he can move into secondary school with that level of confidence. Confidence.
Oh, man. Folks, you're tuned into Bobo 89.1 FM. I'm your host, Chuck Taylor, and it's Healthcare Today with HSA, talking with Ms. Faith Gealey. We're going to talk about stress, stuttering, and some outside factors when we come back from the break. Stick and stay. We still got a little time left right here on Healthcare Today with the HSA.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Thank you for tuning in. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor. We're talking about International Stuttering Day. Actually, my fault. It's International Stuttering Awareness Day. This happened on October 22nd. But talking here with Miss Faith Gealey. And one of the things, Faith, I wanted to ask you about is stuttering can be caught through imitation or hearing another person doing it, and you're hearing it, and then you start doing it. Is this something to be concerned about?
No, it is such a myth. You cannot catch stuttering. Like I said, we all stutter, mm-hmm. and so we, it is natural for us to kind of follow along the cadence of someone speaking, which is why a lot of times when we speak to someone who stutters, if we are modeling that smoother, calmer speech, they may speak a little bit more clearly. But no, you can't catch a stutter. If you're a teacher and you stutter, you're not going to, teach all the kids how to stutter. Like mm-hmm. that is just absolutely a myth. Everybody can stutter. Everybody has the potential to stutter, but people who stutter just happen to stutter at a higher percentage than what is considered to fall within the normal ranges.
Right. And the normal range you said is 2% of your...
Less than
2%.
Yeah.
Of your speech should be... A stutter is normal.
Right.
That is a normal cadence that you can live with, that is workable, that's understandable. What would be one of the higher percentages that you've seen? I mean, and this is not putting anyone's medical out there, but just clinically, what are some of the hires that impair people from functioning?
So my worst stutter that I worked with was not even here in Cayman, and mm-hmm. it was in the university clinic when I was a student. And this person stuttered so much that my professor actually was observing the assessment and came in and had participated because she had never seen someone who stuttered. And she was like a professor with 20 plus years of speech therapy under her belt. And that person stuttered 16% of the time and also had secondary behaviors. Okay. And so secondary behaviors are the additional behaviors that we may see as coping strategies. And so for this particular individual, she had a lot. So she, and it was a girl, right? It was a lady. Mm-hmm. And so, a lot of times a myth is that stuttering only happens in boys because it happens more often in boys, but it can happen in girls as well. And so she presented with a lot of secondary behaviors. So she did some of the stuff where she avoided eye contact and she grimaced. But she also developed some tics where she would like clear her throat or make like sounds like with her mouth in between to try to stop the stutter. So she would like make sounds like ch and that kind of stuff to try to stop her stutter. And, you know, was studying to be a nurse. Wow. And so like really, really wanted to be a nurse and was told by her university, like, you need to get help because your communication is going to impact your ability to be a nurse. And she was still getting intervention in the clinic when I graduated. But my professor said she was able to graduate okay and be okay as a nurse, because I had emailed her. I was like, what happened to so-and-so? And when I go to ASHA from time to time, the American Speech Hearing Association, they have an annual conference. So I go from time to time. And so I often stop by my university booth and say, hey. And so what's cool now is that, you know, you're long in the tooth when people you went to class with, like who graduated with me, are now like professors and, you know, clinical supervisors at our old university. And I'm like, whoa, we're getting old. But yeah.
But the job is I would think that has changed so much over the years. Some
things have changed a lot, and some things haven't changed that much. And so it just sort of depends on the field. I think the biggest thing that has changed is, one, we kind of have more research supporting a lot of the stuff that we did. There was evidence that said, if you do this, this works. If you do this, this works. But like, we didn't understand the why. But now with increased like medical technology, like we know that using like time syllables and using some external kind of compensatory strategies where you're helping to provide a rhythm. We knew that worked, but we didn't know why. It was just a hypothesis. But now with advances in technology
and science supports that.
Exactly. We're able to do PET scans and see what parts of the brains are lighting up when you stutter versus when you don't stutter. And when you add in the intonation, seeing the difference in that, we're able to know that it's these 4 particular genes that are attached to it. And those genes also are associated with that part of the brain. And so, you know, like, so now
it's connecting the dots. So with that being said, what sets the HSA apart? I hear some of it, but I just want to be kind of clear onto it with how they approach and how they continue to help develop languages and cognitives and things of that nature.
Our culture and our core values just really push for a very patient-centered and a holistic approach. We don't believe in that siloed approach where we're just only looking at the disorder and focusing on the fix-it mentality. That is, I would say, the difference between when I was a student clinician and now that I'm an established clinician. The difference is in the attitudes towards persons who have a variety of disabilities. The focus is more on inclusion. The focus is not on the medical model of fix it, fix it, fix it. Yes, we work in a medical setting, but our view is much more of a hybrid where we're including the social model of disability. And so really and truly, our focus is not on chaining you to the clinic for the rest of your life. Our focus is on empowering you, empowering the people around you, educating the people around you, because there is such power in education. We have a plethora of knowledge, not only just from university, but we also have vigorous continuing education requirements to maintain our skill set and make sure that we're constantly challenging ourselves to do what is evidence-based as the evidence changes, right? And so we see that in the model of care that we use, the way that we're very family-centered, family-focused. You know, COVID was a huge wake-up call, I think, for a lot of healthcare practitioners, because with COVID, when you weren't able to see patients, and then you realize, like, these parents were like, what do I do? These loved ones or the family members of the strokes were like, what do I do? And we realized we really dropped the ball, because we shouldn't be so wrapped up in these families having to access me or you or any individual clinician that they can't, at the very minimum, maintain some level of support for this person on their own. And we've dropped the ball. We need to make sure that we're including family education, parent education. You know, we have the siblings come into the session sometimes and participate so that they know how to interact with their sibling. We work with the teacher. We help the child make a presentation to their class. You know, so we're making sure that it doesn't matter what setting that patient is in, they are supported. completely. My personal philosophy is I'm going to love you through it. And I think HSA's core values of being caring, respectful, being responsible, excellence, like all of our core values, and integrity, right? And all of our core values, I think, are intrinsic into like everything that we do in the clinic, and it shows in the results that we get. We get great results, and our families are happy with the services that they receive at HSA. We see a high volume, yes, but you're never a number. You're still an individual when you come to HSA.
And I think that is one of the things that, in closing and wrapping up, that I have to say, you present the person to be able to go out in the world and function.
Absolutely.
Because a lot of times you hear, it was a clinical setting, they were doing fine here, but then they go out in the real world and it's not a productive person.
You might see me. There's times people might see me in the middle of the workday, and you see me at Foster's, you see me at Kirkholme Center, and you see me, you're like, what am I doing there? And you might see somebody in a wheelchair. You might see, a kid. You might see an adult. You might see us with someone. You might see us with a family. And it's like, but it's because we're like, okay, you can do it in the clinic. Now let's do it at school. Now let's do it at Burger King. Now let's do it because that is the real world.
That's where they need to be.
And that's where they need to be. I don't care if you do it in the clinic. Can you do it in your real life? And so we get the patients involved from the very beginning. I sit down with my patients. The first thing we do is have a bunch of bullseyes. What are the bullseyes? Or is it any of these, or is it none of these? Tell me, what is it that's more important to you? Because I can sit there and I can tell you, well, I've assessed your language and I've assessed your speech, and you have a 5%, 5% disfluency rate, disfluency index, and it's characterized by whole word repetitions, and therefore we need to do X, Y, and Z. But I really want to know, I know this basic stuff, but how is this impacting you? Is it interfering with your ability to make friends?
How are you going to stand in line in order, or how are you going to go to the movies?
Exactly.
How are you going to pay for food?
Exactly.
How are you going to function?
I've had patients where they're like, my goal is not to stutter when I play Minecraft, because when I play Minecraft, I do it with the headset and the microphone, and I'm talking to the other people, and I want to make sure I don't stutter. So I downloaded Minecraft onto my laptop, and I bring in my laptop when we have our session, and I'm like, okay, I don't know how to play Minecraft. Miss Faith is old. I may not look it, but I am now. And I'm like, okay, show me how and I'm like, let's use our strategies while you're explaining Minecraft to me. And then and then we practice playing. We're going to do a telesession. And so you stay home and you are going to join our team's call, and we're playing Minecraft, and the kid is engaged. I'm learning something new, and it's like, it doesn't feel like therapy. And the next thing you know, an hour's gone by and the session's done, but the kid is done beautifully,
right?
Because they're intrinsically motivated.
They're growing. Forward.
And that's what it's all about. And that's the type of care that we offer at HSA. And that's not just me. That's my whole team. My whole team is like that. And so I'm just so thankful that we're growing in the right direction with people with the right mentality and skill sets. And, we have such a loving, supportive, and competent, like highly skilled team. All of our therapists have master's level speech therapists. And I think that says a lot about the quality of care and intervention that you're going to receive at HSA when it comes to your stutter. We all know what to do. We're all competent in what to do. And we like to do it in a patient-centered, family-focused way that's also evidence-based. So you're going to see results.
Thank you so much, Ms. Faith, for stopping by here.
Thank you.
Today. It's been an interesting and informative talk, and I hope we were able to help somebody out there make the right choice. If you are in the valley of decision, trying to figure out what to do, give Ms. Faith and the HSA a call, and they can definitely help with yourself or your child or maybe a loved one.
Absolutely. So they can email it just general information, info@hsa.ky, but you could also email me. I'm the team lead, so I'm great at disseminating and making sure that you get your appointment. So you can email me, Faith, FAITH.Gealey, GEALEY @hsa.ky, and you can reach us at 244-7675 or 244-2733.
Thank you, Ms. Faith. That was it, folks. Another exciting episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. We will see you when we see you. And as always, be good to each other. Keep it right here at Bobo 89.1 FM.